Hello everyone, good evening to all. On behalf of GHMC Bhopal, I, Dr. Abhishek Dwivedi, delighted to welcome you all in today's webinar. I will be your coordinator for today's session. Before starting today's session, I feel a great honor in introducing today's distinguished guest, Shri Ramkishore Kanware sir, Honorable AYUSH Minister, Government of Madhya Pradesh, Dr.M.K.Agrawal sir, Secretary cum Commissioner, Directorate of AYUSH, Department of Madhya Pradesh, our Principal Dr.S.K.Mishra sir, Principal of Government Homeopathic Medical College Bhopal, Dr.Roger van Zandvoort, author of Complete Dynamics from Netherlands, Dr.Eduard van Jinsen, CEO of Complete Dynamics Software Netherlands, Dr. Nishant K.M. Nambisan sir, Associate Professor and Nodal Officer, Government Homeopathic Medical College Bhopal. This webinar is organized in collaboration with Complete Dynamic Repertorization Software, Netherlands. Now, I would like to introduce one of the eminent speakers, Dr. Rajesh Rajendran sir. Dr. Rajesh sir has been a homeopathic practice since 15 years and have worked at several places such as Chittor, Belgaum, Bangalore, Visakhapatnam, Anand, and currently practicing in Chennai since 2014. He has been experienced in treating from simple fevers to terminally ill condition with a good repute. He has been actively teaching organ of medicine in which he holds his master and repertory for which he is known the most along with homeopathic medica and clinical case taking. Dr. Rajesh has been active in learning and practice of repertorization. For a decade, he has been moderating a special group solely dedicated for repertorization along with Dr. Roger van Zandvoort, the author of Complete Repertory. Since 2017, Dr. Rajesh has been co-authoring Complete Repertory by adding the contemporary remedy. So, at last, in case of any queries and question, you can post your question in chat and Q&A section, and it will be addressed at the end of the session. So now I am handing over to you, sir.
Yeah, thank you.
Welcome, sir.
Yeah, welcome. Hello, everyone. Good evening. Sorry for the delay. We have been waiting for the other participants to join because some of them have messaged that they have trouble logging in. So we had waited for a while so that they can join and go. So today I would like to take you through this webinar with this also. Like, I just don't want to present some cases or some repertorization. Along with that, I would probably ask questions, and I expect some of them to be answered. So let us make it a little interactive and then go at it. Because what happens is that when one person keeps on speaking, it becomes monotonous. So rather than that, if it is what to say, interactive, then it would be helpful. So we'll go that way. That's the thing that I'm. Dr. Abhishek. Hello.
Yes, sir.
If I ask questions, can I unmute one of the participants who wants to speak and can I switch off again? Is that possible?
Yes, sir. No, sir. From your side, not possible. It is possible to our side host.
No, I cannot do. I think probably
Yes,
you
sir.
can do that. So I'll mention the name. You can. Yeah,
Sure, sir. Sure, sir. I will search
unmute
and
them.
answer.
First, you can answer in chat. You can unmute that person and then.
Sure, sir. Sure.
So there are some of the people. So first of all, good evening everyone, and can you see the screen? Yeah.
Yes, sir.
So today's topic is this techniques of repertorization for quickly reaching the similimum with special emphasis on difficult cases. So this is like a known topic for everyone, but still alluring that you cannot do it. We have certain difficulties and all. Mostly practical problems rather than anything to do with theory reads. I think everyone knows all those techniques of repertorization, like Kentian method or Robert Boninghosen, all those things. Even the specific, based on specifics. But where comes the problem? That is what we need to discuss. So I have asked some of them, I have asked some of the people to say what are the difficult cases for them. So in one of the groups, um, in the complete repertory clinical groups, clinical cases group itself, I have asked for what would be the difficult cases for people. And some of the answers have been like how to treat autism, how to treat PCOD, PCOS, psychiatric cases, so on and so forth. These have been as difficult cases. So I'll just enumerate some of them and probably ask a few more, allow some more to answer what are those difficult cases. And then we'll go ahead. So according to first one of them has said the case taking and premature weighing of case autistic spectrum disorders. This is one thing it seems that is difficult. And for one more person has said that find the cases where we cannot find characteristic symptoms, striking, peculiar, uncommon, strange symptoms and signs. One more this thing is old standing cases where the primary mental symptoms had gone through a gradual reactive adaptive changes that produce a completely different mental picture. So these are some of the things which they find it to be difficult. And then someone has said that rheumatoid arthritis and schizophrenia case. And one more person has said that repertorizing using BBCR method as finding the person in the disease is many times subjective. And one more, Gauri Nandana has said that conversion of patient language into Urdu, especially mind movements. Someone else has asked psychiatric cases, especially paranoid disorders, schizophrenia, malignant, and benign tumors. So these are the things that people probably consider seems to be difficult cases. So now I just want to ask some of the participants who are here. According to them, like I give two to this for at least 5 people, let us say. So 5 of you can say what is the technique that you use, or what are the difficulties that you face, and then what according to you is the what to say. What according to you is the difficult case. What is the difficulties that you face, and what is the technique or method that you are following, which is being helpful or not helpful. Then we'll just I'll just listen and then we'll start with the presentation. Is that okay? So I'll see who is ready to speak regarding this. Dr. Akash, are you willing to speak? Or anybody who is willing to speak for a while, welcome. They can say yes in the chat and we'll let them speak. Yeah, who's speaking?
Yeah, please speak, Dr. Tamanna.
Yeah, sir. My question is that rubric hunting is difficult for me to find the perfect rubric in the case is difficult for me in chronic cases.
Okay, what do you do for that? Usually, what is the method that you are following as of now?
Usually I follow Cantanian method,
Okay.
and in mentals I find difficulties to take rubrics.
Like, for example, like give two examples, three examples.
The main problem is that I cannot convert the patient language into rubrics. This is
Okay.
the main problem.
Like, for example, just one example, like patient, what does the patient say? What is the difficulty that you face?
For example, patient says कि मुझे ऐसा लगता है कि जैसे मुझे कोई मार रहा है.
Okay.
That somebody is beating me.
Yeah, I understand. You can go ahead.
Yeah. So like this is difficult for me to change into a rubric or remember rubric at that time.
Okay, good, nice. So someone else want to ask? Not ask, but tell what is their difficulty, what they have been doing, what has been happening. That's it.
Sorry, your voice is breaking.
Can you hear me?
Yeah.
Yeah. So thank you, Dr. Tamanna. Now let me ask someone else. Like whoever is willing, say yes, and
Yeah, sure.
will say allow them to speak. Let two or three people speak. Then I'll go ahead with the presentation.
Please write yes on the chat box.
Anyone who is willing to ask or say that this is what they are following and this is the difficulty, they just say yes, and we'll allow them to speak. I think everyone is shy. They don't want to speak. Well, good.
Yes, sir.
Of course, everybody is a practitioner. Every student should be willing to speak, and they should. That's what we expect, right? If at all, if you are shy, how are you going to speak to the patient as such anyhow? Nobody willing, or I'm not audible. Okay, Sarita Nigri, some new rubrics lack. What do they lack?
Yeah, Priya Malve, please you can.
Yeah.
Hello, Priya Malve, please go ahead.
Hello. Yes, ma'am. Hello. Yes, sir. Hello.
Yeah,
Yes,
hello.
sir.
Yes, sir. Yes, sir. Hello, sir. Good evening, sir. Yes, sir. Sir, my problem is that, sir, according when I read the case from the boric and the the results are different from each others.
Okay. So
Then it was very problematic that, no, sir, which medicine I have to choose.
okay. So how do you do it, Boric or Kent? Do you do it manually or through the
Yes,
computer
sir.
software?
No, sir. I do manually. Most of the time, I do manually.
Okay.
Yes,
If
sir.
you case through a computer, how do you do it?
Yes, sir.
If in case you have to do with a computer or a mobile phone, do you find it better then?
Yes, sir. I find I have already an app that is Materia Medica Lite, and this all the apps Kent and Body Repertories all are there, but the
Okay.
both results are different, sir.
Okay. But today we are going to do with complete repertory. Are you familiar with it?
Yes, sir.
Yeah.
Yes.
So have you done repertorization through it any time and any difficulty with
Okay.
in any software? Complete repertory is present in several softwares. Have you ever done it?
Yeah, I think it is. Yeah, no, sir.
Okay.
No, sir. It is not. It is not completed. Completed. I have not completed repeating.
Okay, fine. Okay. I'll explain whatever I can and I'll tell you why the results are different and we can go.
Okay.
And
Okay. Thank you.
in
Okay,
case
sir.
it helps you,
Okay.
that's fine. I'll come back to you at the end of the session and I'll ask you if that is helpful. This will
Okay,
be
please, sir.
yeah, sure.
Okay.
I have noted down. Anyone else? Anyone else want to ask? Is there anyone else who want to speak, or shall I start with the this one presentations?
Shivangi
I
Meena.
think, yeah, Shivangi Meena, you want to speak? Yeah, please go ahead.
1 minute, sir. Yeah, I unmuted him.
हेलो
Yes, ma'am. Tell me.
गुड इवनिंग सर
Yeah, good evening.
सर वो मुझे मतलब इस चीज में प्रॉब्लम आती है जैसे कोई भी केस हुआ उसमें मेंटल सिम्टम्स देख के उसकी रेमेडी निकाले या फिर उसके मेन सिम्टम्स देख के तो कभी कभी कंफ्यूज हो जाते हैं कि कौन किस अकॉर्डिंग मेडिसिन ले
वापस बोलिए, समझा नहीं मैंने.
सर जैसे कोई भी केस है
हम्म.
तो उसके मेंटल सिर्फ माइंड के अकॉर्डिंग उनको मेडिसिन देनी चाहिए या फिर मतलब दे सकते हैं या फिर उसके मेन सिम्टम्स को भी देखें
ओ ठीक है, वो आपका प्रॉब्लम है. आप कैसा दे रहे हैं या आप पढ़ाई कर रहे हैं?
सर अभी तो मैं स्टूडेंट हूँ
ठीक है, आपका मैं जवाब दे दूं. प्रेजेंटेशन के बावजूद मैं बता दूंगा आपको क्या करना है इस केस.
यस सर
Thank you very much for asking. So some of them they're desperate that the presentation gets started. So I'll go ahead with the presentation directly. So good evening all. Today's topic is this one. Techniques of repertorization for quickly reaching the similimum and with special emphasis on difficult cases. It's a very unique topic and it's also a vague topic. That's what when one of my friends who's an allopathy heard and said that, isn't it a vague topic? For me also it is a little bit vague. Why I'll tell you. There are several techniques which is good and it is to be learned. It's a must learn thing. It is something that one has to learn. Every homeopath probably should learn. But the next was that are quickly reaching the similimum. Quickly reaching is yeah, you have to decide in acutes within a few minutes, and in chronic probably you can take a couple of days out and you can prescribe. But you cannot spend hours together on it. You want to finish it off within a short while. So that is the reason why one is desperate about reaching it quickly. But the problem is there are difficult cases. How do we treat? So are there really any difficult cases? And if so, what are those difficult cases? That is what we do. So everyone, what they do everything that they have to do before coming into an anamnesis, and all things done and dusted. We have the full case at hand, but we don't know to proceed, how to proceed, or what to do. Like whether to concentrate. Someone was asking, right, whether we should concentrate on mentals or physicals or whatever, or which book should we approach. Like for example, Boric, and or I'm unable to even think like a certain sort of symptom. Just bleeding by someone, I'm unable to find out. How do I find out? These are the things that come into the head, right? Today, someone has asked me what is the root for holding the forehead while coughing. That was the question. And one more person had asked for holding the same person has asked. So the same person has asked holding the knee while coughing. What are the remedies in it? So I had replied it, and like, how difficult is it to find it out? These two symptoms. Is it really difficult to find these symptoms? The question was holding the forehead with hands while coughing. So there is this particular rubric. Pressure presses forehead during cough. And one remedy, the one and only remedy is Badiaga. And the other one that he has asked is holding the knee. So hands and knee on amelioration. This is one thing, and these other remedies. So let us say that this is in one patient itself. Probably that's why he has asked it together. And if we add this, that hand and knee on amelioration, and then these are very small rubrics, right? If you see, there is one remedy in one and two in another. So we are obviously confused. There are two symptoms there that are very strange, rare, peculiar. Nobody ever says that, and this is what we have to concentrate upon: strange, rare, peculiar symptoms, and we'll have to prescribe on them. So now we have three remedies, two peculiar symptoms. What would we do now? Should we go with Badiaga or should we go with foliatum? And what is the approach? Shall we go with Badiaga or Repertory? So this is what we have. Only these two symptoms. We can't do anything. So is there anything else that we can do in the sense? Yes, we can do. What we can do is we can further ask patient, like what sort of cough is it? Whether it is a dry cough or a productive cough or sudden paroxysm. Let us say it's just a dry cough. And then he has to press the forehead during cough. So what we do is we'll take something is happening in the head and we need to address it. So it is probably the pressure or tension or something that we need to do. Intuitively, if we ask what is that is happening with your head, that we have to hold the forehead, one might say there is a pain, so I want to press it, or I just want to hold it. That can be a possibility. So we'll take one of the possibilities here, that is pain in the head during coughing. And so what he is doing is pressing the head with the hand for amelioration. So we can take head internal pressure of the hand amelioration. We can take pain head foundation by pressing with hands. And you now also know that where does he put this thing? Hand that is on the forehead. So you just take the location rubric, pain head, forehead. So now you can see Badiaga is missing, Repertory is missing, several other things are missing. But what we have done is we have divided one very particular rubric into two. And that is, this rubric has certain components to it. That is head, pressure, presses forehead. That is, he is doing a particular thing. And when he is doing it during the cough. So that is just a manifestation. That is a phenomenon. But this symptom alone cannot help us in this case, since he has also other complaints, or since there is one more peculiar symptom, which is this one, cough, while coughing he wants to hold his hands on the knee. So what we need to see is any remedy is there which could actually help in both of these things. So there is one more rubric, position, hands on knee. You can go and see there are two more remedies, AIDS and Sinner. But still, is there any clarity of which remedy is going to help in the sense? We don't know. In Repertorium, if you see how many symptoms does it cover? So now you can see Badiaga, which covers 3 of the symptoms. Repertorium, in that it is covering a little more of the symptoms. So we now can confirm that the affinity of Repertorium on the head, especially the forehead, during cough is there. Since it is covered, it also has dryness of the dry cough, and it also has this another peculiar symptom of holding the hand on the knee. So can we go with the Repertory medicines? One could go ahead, or one could go with the Naxomica, which is covering more than symptoms or calcarea up, given that it matches with the generalities or most of the symptoms. What I mean to say is, like, rather than relying upon a single remedy, rubrics, which doesn't cover entire totality, but they are still saying that it is peculiar. Peculiarity is to be decided by the patient or by the nature, rather than if we feel, oh, this is amazing, this something is. Because anybody who has headache usually presses their forehead. But the thing is, during cough, but many people, you might have seen, they do have the pain during cough. The thing is, it is not present or represented in material medicine. So we have to look into that angle. Just because it has only one remedy, it doesn't mean that it is a peculiar symptom or we have to rely upon it, or that is the only remedy. So pressure upon the head, amelioration is something that we can look upon. Or this is how we actually have to go over. It is said in the case taking that you cannot cross question, or you cannot give leading questions you cannot give leading questions to the patient to go ahead with the flow of the case taking, because it can alter the questioning, it can alter the flow of thoughts of the patient. But at the same time, if they give very vague things and if they are not helping, then what we have to do is take one and then further build upon it and ask. Also with this, we obviously understand that the cough exhausting or unable to person is unable to sit or stand and has to support the entire rib cage, right? Like we'll put like this, like I'm putting my hands on the chair. This symptom is there for some of the things like holding while defecating, holding while urinating. Same way while coughing, some people they hold the adjacent objects, which is also very similar to holding the knee. It is a particular position that is bending. So you will have to use your perception that one wants to bend down and then cough, rather than like, oh, the person is having his hands on the knee. That is a very peculiar thing. One has to do it or do it. Because there is one more symptom in Pyredia brava, wherein a person has to sit down in a particular posture to this thing. That doesn't help in each and every case. Some of them they say that. But what you should do is like collect the entire symptoms, even the mentals, physicals, and then build a totality and see. Not just go with the small remedy rubrics, because that may not be the case with the that may not be the indicated remedy, and what it could cause might be this thing. This is like I just wanted to start with this very small thing. It could be a little unclear. Let us go a little further and see how it will go. So the question with many of the people is always this: what is right, what is not right? What is a strange, rare, peculiar symptom, or is it the strange, rare, peculiar symptom, or what is that methodology? Shall we go with a single one? Shall we go with the totality? Even in the totality, or what is also called as classical homeopathy? Whether we should go with Indian method, whether we should go with Bonning-Huss's method, whether we should go with what to say, um, any specific method or a single rubric or any other new methodology that has been founded by people. So shall we go with that? That is one more thing that people think of. That is the eternal question. So they try to look into the case, and when they look into the case, what happens is that they're not having enough of the symptoms to look into the what to say, repertory, or they don't understand how to go about with the repertory, because to go with this, with a certain criteria should be filled in, right? Like for example, for Kendian method, there should be more of generals and then some of the particulars, and then so on and so forth, which are not there. And in Bogle Bonning-Hussen method, one has to have certain particulars, time modalities, personality, and all those things, and which is not there. We only have few symptoms. So there comes the problem. So these problems are the things that everyone faces, but within that, people rely mostly upon material medical knowledge. That I know this, so this is the strange rare thing. This is what Toric offers. This is what Fartak offers. Fartak, why? Because it is based mostly on his experiences. It is out of the mountain order, and it is of the confirmation. That is how they say, and we just tend to follow those things. But before going to all these things, let me bring forth to you one important thing that everyone should understand or notice before going into, like, why we need repertorization at all. We need repertorization. First, we'll read the preface of. I'll just not mention the name of it. If any one of you can find out which book is this, it would be nice. All right, I'll mention. So this is what are the uses of repertory? I don't want to read it. You can see on the screen by explaining and reading. Repertory is not meant for the use. That is a third paragraph. In those cases where there is a clear indication of similimum, in those cases, the additional symptom that might be secured from the patient and the pressure of questioning possibly would confuse a case that already stands clear. Like when the case is very clear, you don't need to repertorize the case, or you don't need to question them again and again to get a similar, because you already know it. All the symptoms, I mean to say all the symptoms, at least 5 to 6 symptoms, not just one symptom, or indicating towards a particular remedy. So you don't need to repertorize, or you don't need to go further into this. So that is the thing. So where were we? So we don't need to pressurize and question more and more when it is clear. It might be used in manner for quick reference and to verify leading indications for remedy. And if some slight doubt were felt, differentiate between those seemingly indicated in clear-cut cases, even if the representation verified itself for the students of material worker, this would have been a waste of time. Yeah, this is one of the things that people often mention, sir. Patient सामने बैठा रहता है और उसके सामने एक एक ढूंढते हुए सिम्टम को डालते रहेंगे, जो आता है उसको देना. Like what they want to say is that patient is in front of you, and you want to waste the time of the patient, or patient might get impatient when while you are trying to check each and every symptom, and you want to repertorize it. Is it time consuming? Is it making the patient to be like restless, impatient? So these are certain questions. Why would we need to repertorize? Is it a waste of time? So for those who are very good at materia medica and very clear in perceiving the symptoms and in this thing, it may not be that useful. Is it always the case you need to ask? Probably not. That is not helping. That is why we are here. That is why we want to learn these techniques of repertorization to reach it in a very fast way. So whether or not we can reach it in a fast manner, we'll know. Is it that easy, or how much time has to be spent on this? We'll get to know. That's the motto of my seminar. Let's see. On the other hand, we must take into consideration those physicians who have not gained thorough knowledge of materia medica, like me, or to be considered still more those chronic cases where several memories emerge commonly in shadowy outlines from the background. That is a network of chronic symptoms, even more intricately woven. The physician, okay, case that have suffered many things of many doctors, case with mismanagement after mismanagement, superimposed circumstantial stress, and that again upon the hereditary tendencies, these cases rarely show a clear picture of single indicator remedy and very often show a related group of remedies. So this is like the case picture, it gets modified because of the previous treatments through allopathic or homeopathic medicines, and upon the circumstantial problems. Like there is a person, एक इंसान बीमार है, and there is a family loss. Person is sick and there is a family loss, which adds to the misery, and then there is a financial loss or financial liability, which again adds up to it. In the sense, every assault modifies the picture of the disease, and when they come to you, it might be with several of these factors, and the pathology might have lost its originality in itself. So this is what happens with many of the cases that come to us. Why? Because even on Hahnemannian times, but during our times, what happens is that people usually try a lot of different things, lot of medications, allopathy, even home remedies they try, and then they come. Sometimes it also happens that they have visited one homeopath wherein there has been not been considerable result, they come back, or there is also a possibility of they have used a particular medicine or a particular complex, it has suppressed it and new disease has come up, and then again new one has come up. Like for example, a person had some dark pigmentation or eruptions upon the leg. So what this guy did is that he went into allopathic treatment or some treatment that their parent has taken. जो वो छोटा था and he was very young. They were not aware of anything or like the side effects or something. They have taken the small eruptions upon his leg or something. Then what happened is that they have given some medicines, and these black spots or these eruptions, black eruptions, they stopped, they went off. What happened is that this guy who was like very plump and had a rounded face slowly started to stop growing, and then he got very hyperactive. That is in his progress of this, what to say, is progressing through his age. Then he slowly started getting white patches on the leg, which they didn't understand. And after a while, they found out that the medication that he was using for suppression of those eruptions was also hindering with the production of the melanocytes. And now he has full blown vitiligo. In between, what has happened is that he has been separated from the family, or he had to go to different places, deception in love, wherein the case has become multifaceted. So this is how things get complicated. In between, this person happened to visit a homeopath who has given him the specifics of vitiligo, that is R-cyanide, then Merck and sugar together, and some other remedies. So when this is complicated with so much of artificial disease or induced disease, what a homeopathic medicine does is, जब आप दवाई देते हैं, what happens is it goes and produces an artificial state. That is what we see in drug proving, right? This is capable of producing all these things. That is why it can remove. So that is induced, which is a little powerful than what what the disease is, and that's how it gets removed. But what you are giving is something else, and which is of a higher power. And sometimes people repeat it again and again. So that makes an assault over the body, and the picture gets changed. That's how it comes to us most of the times. And there are other things like hereditary tendencies which could affect, and then so all these things modified. So how do we go about why I had taken up this thing is that there is a very important line. Often it is impossible to see any remedy likeness in such symptom group without careful repertorization. But with that analysis, we may see not only the single indicated remedy, but we may trace the probable sequence of remedies that may be necessary to bring the case to the desired cure. For it is impossible to envision the probable sequence of remedies at times. Just as we can look back over a chronic history and see the indications of various remedies at various periods in the patient's past. The value of any repertory depends upon several elements. First is the art of physician in taking a case, which is very important. Knowledge of the repertory one attempts to use, its philosophical background, if it has any philosophical background, but not its construction, what are its limitations and its adaptability. And upon all these things, very important thing upon which I have based the presentation is that intelligent use of the resulting analysis, how we are going to use the analysis result. This is what the problem is. So why we are here, what the topic is all about, in the sense, we want to reach a similimum very fast, and we want it to be to some technique, and most importantly in difficult cases. So are there any difficult cases? Is it this is what? So who comes first? Is it the methodology of repertorization, or method of case taking, or the philosophy? Is it the particular method? Which method is the best, and why? Now, all these questions arises when we take up this case, and we get into the situation that we have read all of it. This is from the Bonninghausen's therapeutic pocket book, introduction. You can see on the heading itself, introduction to the therapeutic pocket. The next consecutive pages, if you can go through it, there is an introduction written about this Bonninghausen therapeutic pocket book. So while Bonninghausen was going through the provings, he found that every symptom, even the provings, are incomplete. So he wanted to complete them with some of the factors, which is like every symptom can be divided into different types. The symptom, like I have pain, is very general symptom, but then I have pain on the right side of the head above the eyes. It's very specific. Or I have pain that is in the abdomen, and then it is going radiating to the back. From there, it is going down to the through the thighs to the popliteal fossa, which is on the right side. So you have a location from which it is extending to another location, and from that location also to a another part, which is like on the particular side, right side. So what would be the rubric for this? In the sense, abdomen pain extending to back, again extending to hollow of the knee on the right side. Is it possible that such a rubric is present? There are some rubrics, of course, in some of the old repertories which are very long, but in factual things, it won't be available. So how would we complete in the sense? There has to be a criteria to make a symptom complete, right? So Kent had this idea of side time extension in modality, on which side it is, and at what time it is happening, and where is it extending, and what are the modifying factors. And Bonnie-Hosen came up with the concept of location, sensation, modality, and concomitant. Concomitant, we all know that there's something that is not related, but they're present in another system. So this incompleteness of symptoms, both in 2 weeks as well as in the patients, led to the methodology of what to say, making a symptom complete. Whether Kruger might say it is in an incomplete form, which we get into the materia medica. But then, while compiling a repertory, most of the repertories that we have from Kent, Bonnie-Hosen, to any other people, those who have done this logical iterative group of repertories, they made sure that through their clinical experiences, these symptoms are as complete as possible and as general as possible, so that they can be used in a manipulated manner, wherein you can find out whether this has been covered by a particular remedy. So that's how this came into place. So I have not placed the entire book because showing this itself is should be like going for someone, and most of you might be actually looking forward for how I will be showing some of the rubrics and then working on the case and all. So I definitely do that. But the thing that we have to understand prior is this problem has been there from earlier days till now, that how to convert the symptom into this and how to go about what is the methodology. So before going there, there are several things that we need to look into if you want to be good at prescription. It's not something that lies in the repertorization itself or in the method itself, but there are things like we need to understand. So we'll come back to this one. What is a difficult case? What makes it a difficult case? Is it the pathology, or is it the diagnosis, or is it the complexity, or is it something else? So some people say that oh, this disease, the name by the name, like I heard that there is muscular dystrophy, or macular degeneration, uh, this one, any other disease for that matter, Parkinson's, schizophrenia, benign tumors, cancers, psychiatric disorder, ADHD. So, in the sense, do they make it difficult by the name of the diagnosis itself? Oh, whether we can treat. I have heard some of the people, sir, आपके होम्योपैथी में ट्रीट कर सकते हैं क्या? पूछने वाला पेशेंट नहीं है, पूछने वाला होम्योपैथ है. होम्योपैथी के स्टूडेंट आके पूछता है, सर आपके होम्योपैथी में ये ट्रीट होता है क्या? Whether it is homeopathy, allopathy, or Ayurveda, or any other system for that matter, disease like these are the diseases that can be cured. These they cannot be cured in the sense. One limitation for homeopathy is surgical cases where surgery is needed. There might be some of the diseases which need some sort of intervention or some sort of supply of a particular thing which is needed for medical. For example, insulin dependent diabetes mellitus, where they are dependent on insulin, there has to be supply so that the levels have to be maintained. Even those cases can be treated actually, but that is difficult, let us say. But other than that, any symptom, any disease which has signs and symptoms or curable, what we are concerned is with the signs and symptoms, right? Why we need the diagnosis? Do we not need the diagnosis? We definitely need the diagnosis, because It gives you information about the location of the seat of disease, and it tells you about the changes that have taken place in that organ. And if you have studied physiology, you will know that what function is being hindered because of that pathology, which is essential, because that is what you need to correct, or that helps you in identifying what could go wrong further, and that could help you. So you will also get to know the remedy. You also want to know the remedy that has action on the specific organ, rather than being very superficial acting remedy. We get to know in the medical record, right? This is a very deep acting remedy, or this is a remedy that has specific action upon the particular organ, like ceranthus on the spleen, cactus on the heart, so on and so forth. They do have affinity in other organs. So, but there are some of them that, like these, we do have polycrust remedies like phosphorus, arsenic, or even lattices. They have affinity on all these things. So pathology or diagnosis, does it make it difficult in the sense? Not necessarily that it has to make it a different one. Is it the complexity in the sense? Well, that is whether the disease is complex or simple. Patient has come to you. It is our duty to treat the patient. If it is not possible, if we think that it is not possible for us, we'll have to refer it to a better person or better system. Like we'll have to see whether this is treatable or not treatable. What is the stage of the disease? Whether there is any scope for the prognosis. That we obviously understand to understanding the pathology and the diagnosis. So what else is left? Or what actually is the problem? That is the problem with the homeopathy itself. Most of the homeopaths, we fail to think with confidence, or most of the homeopaths, they think whether this remedy would work or not. There is a doubt. Some would say, sir, I had put every symptom into the repertory that I had, but nothing is clear. And one more says that, sir, कुछ भी लगाओ, हमेशा सल्फर ही आता है, arsenic ही आता है, lycopodium ही आता है, especially with modern repertories like this. तो क्या सर कैसा रेमेडी देना है? Is it the problem with the repertory or with anything else? It is probably with us that we should understand, like what have we missed, that we are only getting the polytrust. Is it really the problem with the repertory itself? Because many people say that, yeah, when you use modern repertory, like complete repertory or synthesis, you find it like कुछ भी डालो वही 10 रेमेडी आता है, लैक्टिसिस, लाइको, सल्फर, आर्सेनिक, यही आता है. Because they have 8,000, 10,000, 15,000 symptoms. So whatever general symptoms you put in is going to bring up only these remedies. That is one thing. The other thing is that, like one of the students, while I was teaching, एक ने आके पूछा, सर आप ना ये जो क्यूर हुआ बोल के दिखा रहे हैं केस, ये सब आपने देखा है, हमने नहीं देखा. The student is saying that, sir, you have seen these cases, you say that you have cured these cases, but I have not seen the cases being cured by homeopathy with my eyes. Like if you didn't see, does it mean that it doesn't cure the disease? No, sir. I have never seen a case being treated by homeopathy in our college. That's our answer. The problem is with what? Is it like the facilities were not there, or she has not seen? But when she asked, she was not even in the clinicals. And the clinicals in some of the colleges, they are posted from until final year. It is mostly into the allopathic fraternity. Like in most parts of North India, they send them to the GH, whichever affiliated GH they have, what the practitioners of small clinics are, and they learn. The facilities are not. But that doesn't mean that it cannot be cured or one has not seen. Some people, when they see all these videos that gets cured, they get inspired also. Some people, they are in a disbelief that whether it will treat or not. So the dilemma always prevails. They look into it. When they come out, they follow. Several people say that they are doing it. They treat several cases. They cure it just like that and all. And we do get interested in it. But still, most often, when a particular person is stepping into following a particular methodology or a particular school of homeopathy, it is because of the disbelief in himself. And most of them into this sort of dilemma or doubtfulness for their own confidence. They want to learn like, sir, homeopathy में कुछ scientific नहीं है. Scientific है तो भी how to explain. That's why I follow Master Ji. वो Master Ji बताते हैं कि इसको you can relate it to this in a particular subject of medicine or according to surgery, according to pathology. Yes. But we are taught in the college itself that how pathology is. Just because there is no interconnection between materia medica or non-increasing doesn't matter, doesn't mean that homeopathy doesn't have any. What you need to understand is the process and you will have to apply it. Like I'll come back to the details of it. So one student has asked, एक student ने ये तो पूछा, एक दिन ऐसा हुआ, मेरा एक दोस्त है जो ये प्रेजेंटेशन के लिए बधाई दे रहा था, वो कॉल करके पूछ भी रहा था कौन सा शर्ट पहनने वाले हैं. अन्ना ये शर्ट వేసుకుంటాను నువ్వు, that's what he asked in Telugu. What shirt you are going to wear? How are you going to present? He is very interested in homeopathy. He's a surgeon. So this surgeon boy, he was telling, I'm not getting too many cases. I want to be hands-on or else I'm feeling depressed. One day he told me that. And afterwards, like I told, you get, don't worry, all these things. When I asked him, why are you worried? Like, it would come anyhow. If you're getting time, why don't you spend time reading or anything else? No, maybe I'll forget it. That's what he said. I gave him an answer. I'll tell you what was that answer after a while. So a few days later, when I gave that answer, a couple of days later, what happened is that he has got a case. And he has not seen that case ever while doing his MBBS or during his post-graduation as a surgeon. But there were no other people to assist because it was night duty and he has to perform it. And he performed it and he has successfully performed it since. And he called me and said that I was complaining to you that I'm not getting any cases hands-on during this period. I got it and I did it. I felt like I may not be able to do, but I still did it. So we have been friends since almost 12 years. What I told him then is like, you know the basics, you know anatomy, so you know where is the blood supply happening. You know where is the, what to say, veins coming out or where is the arteries going in. And then you know where the organ is located, which organ is above, which organ is below, which organ is on the side. And you know what is the pathology around it. And you know what is to be corrected. And even if something goes wrong, you know how to manage it. So that is what you need rather than whether you have seen the case earlier or not. So that is what is with homeopathy also. Like if you have read and if the symptom is clear and if it is given in more than a couple of materia medica, it's obviously going to cure that symptom. So one has to believe in that. And then only they will be able to cure that case. So in terms of that, in terms of having a doubt on the remedy itself, has to be avoided. Actually, first go ahead. So that is one very important thing that one has to understand. You need to focus on the materia medica. You need to believe that the remedy works. And if you know the basics, you know the basics of homeopathy, you know the basics of you know the basics of anatomy, you know the basics of pathology, you know the basics of pediatrics, whatever it is today, surgery. We need to learn surgery, right? To know what is surgical disease. If you are not capable, we have to just send the patient that, okay, you need surgery, it is progressing very fast. You just go on. That's what we should say, right? So that is very important. Like when you have basics, you can actually do wonders. So that is one thing that one has to remember. Upon remembering all those things, every case is actually a difficult case. I'll say why. Because every patient is very unique. He comes, it's like patient comes to you and says that I'm going to tell you a story. And that story can be only one line. Like you were supposed to tell a story. That's what we indirectly think that. what is this? This guy is giving only a couple of symptoms. But according to him, that is the story. You will have to make him speak, you will have to expand upon the story, and you will have to build up. And there is one more quick person who comes and tells stories. That story has several sub-stories. Again, the sub-stories have some more stories. You get confused and you don't know which one to pick, which one not to pick. So that is the other problem. Every case is a problem. I'll get into that. Most of the people you are like, what is this guy? He's not telling anything. He's just speaking. So let me go back to the case for a while, and I'll come back. And like when I started this, someone has called me, right, just a couple of minutes ago, and like they were asking which remedy to give and how. So this was the case yesterday about this one. Yesterday, one of my friends, one of our colleagues, I think you people know probably, he called and he said that his daughter is having fever since evening. And how did it develop? Subhaveto, she was telling like I'm feeling weak, but we didn't find it anything different. So we just left it. And after a while, again, when she was saying weak, we just checked the temperature. Then we found that it is around 99 degrees Celsius. So it's, by the evening, by 7 o'clock, it got little worse. They called me then that the fever has increased. And that's it. So this is the information that I have. What will you do? Like fever in the evening, and then weakness. That's all. So we'll need to ask more, right? So I asked, did she have food properly? Then no, like she was okay. We had to just nag her because she's a child. We know that's what the answer is. So whether the appetite is diminished or not, we don't know. And she woke up at 10 or maybe 12 o'clock. So we don't know. Like if she may ask for food later on, we will give. That's what was said. And that was one thing. I still furthermore asked that is she feeling thirsty? Thirst, I can't say she's having, no, this is she active or dull? She's active. So this was the only thing. Then I asked, is there any cough? Then they said that, yeah, a little bit of cough is there once in a while, but it's not too much. She's very active and she's playing. So what do you want me to do? You prescribe. That's the question. That's the thing. Like all around, there is COVID going around, and it might cause trouble. But I don't have a big totality over there, right? It's very small. And what could be done? So what I did is I repertorized the case, and what symptoms I took. I'll just tell you. So what I did is I asked for the picture of the tongue, and then I took another half an hour because I was busy with some other patient. Then I asked that now that it is 8 o'clock, is she feeling hungry or not? And they said no, she says that she's not hungry. And then I had to think a while, and then I asked whether it is sunny over there or is it was it raining? Then the reply was like it is raining obviously here in Mumbai once in a while, and it's a little heavy also. But we don't go out. She doesn't go out and work. She's in the home itself. So I had to ask whether it is cold inside the home or it is how is it? Usually, if it rains, it is going to be cold, right? Then they said that no, in the afternoon it becomes a little cold, and then in the night it gets a little warmer, and we have to use the AC even during the rains, probably because they are in the coast or because of any other reason. The concrete houses emitting the heat, and they need to use the air conditioner even in the summer exits. So what's happening here, let us say, in this case, first thing is that what she told is there was weakness even before, right? So there was a weakness even before. वही बोला था पहले, शुरुआत क्या हुआ था, वीकनेस था, उसको वीकनेस लग रही है तो हमने टेम्परेचर चेक किया, तो फिर हमको पता चला कि इसको बुखार है. So we'll consider it started with weakness. Only 10 remedies are there. And then abhi weakness है क्या? It's now 8 o'clock. How is the fever now? Yeah, even now there is fever. There is weakness. So we have two symptoms. And बुखार कैसा आया? अचानक से आया ना, बोल के तो नहीं आया था, या धीरे धीरे से तो नहीं आया था, अचानक से आया. So that is sudden. So when you see here sudden doesn't have any remedies, that doesn't mean it doesn't have any remedies. You will have to click over it. So sudden is either paroxysmal. Sudden paroxysmal is both of the synonymous words. That is how repertory is represented. Sudden is just one word. Most of the repertory is has synonymous words to it, so that the old and the new terminology is understood. So fever hits, that is paroxysmal. Let us take this. And then I asked for the tongue photograph, right? Because the tongue was dry. That's all. We were not sure of the what to say, thirst. So we couldn't take anything about it. It was dry tongue. And then the appetite was diminished. So we take appetite diminished. And then what do we get to know? There are two things. Like it is rainy. So we'll take rainy weather. And this is Bombay. So and they said that in the night what is happening is that there is warmth and we have to use the AC. So what do you use for hot days, cold nights? There is one rubric. But then there is also this one which represents the hot days, cold nights, that is sultry. We can also take change in temperature or change in weather. Is it really changing in the sense? No, it's still raining. So when there is wetness and then when there is heat, then you can think of sultry weather. Now what would be the remedy? All the polygrust. So we have Nux vomica, Ipecac, we have Pulsatilla. Isn't it a difficult case or is it easy? For me, of course, it is difficult. Like which remedy to give again? So see this one. This is Nux vomica. This is Ipecac. All polycrust, rustox, we can say all the top 7 remedies probably they cover all these things. We are not sure. We don't have enough of information. So based on this thing, what to say, prior knowledge about her health condition, what remedies have been indicated, and all. What I said is that okay, yeah. One more thing is that she has cough, right? Fever. So what I said is that Sabadella probably should have those thick discharges, and then head would be very hot, like the mood would be very erratic of Sabadella, wherein one has to wash the face, wash the head, so that this comes down. So that is one thing. Nux vomica, I didn't find any irritability, but I told that I thought that okay, let us keep a standby. And Deepika was promising, like the child was very delicate child and is quite vivacious, likes dancing, all those things. And the child was very active, right? Even during fever, the child was active. You can add that also, which I did do. You can say playful, you can say active, but all these remedies anyhow have this. You can obviously see Naxonka would be there, even Ipecac would be there, all those remedies would be there. So with the cough affinity, with the lungs getting affected, with the previous this thing, what I said is that you go ahead with the Ipecac. It was the prescription based on some intuition, let us say. But I said Naxomica also could help. Let us see, but you start with Ipecac, 1 dose now and then tomorrow morning. So after 1 dose of Ipecac, I received a WhatsApp call or WhatsApp message saying that the child is better and the fever has subsided. So I said that tomorrow morning, let us see what happens. We think the case is cured. It didn't. If it had got cured, it might be very, very well, but it didn't happen. So today again, in the morning they said that she was fine until she was sleeping. When she woke up, she again developed fever. But she is active, she is well, she's doing this. So I was busy in the afternoon, and when I got the call, I said I'll call later, and then I asked, so how was the appetite? She had, that's what they mentioned. This is in a very dull mood. Then what they said is they have another child, in group 1. They have, she also is having fever. And there is a old person in the family who is also having fever. Fever along with cough. So they are worried it could be COVID or something, and they have asked this child not to go to the, what to say, go to this younger kid, and they were worried that what could happen. So this child was weeping, it seems, and that's it. They were still not ready to tell much. And then mother explained some more things after that, saying that whenever she gets dreams, after a couple of days, she gets this fever. So what sort of dreams are there? Since even the other thing is that whenever there is a dream, she even passes urine in it, and she wakes up suddenly and asks, "Why am I getting these dreams?" And usually the dreams are like parents are getting old, and that is nightmarish for her. In a couple of days, she gets it. So, and that's what I added today to the totality, and then. I still felt that Luxomica could be or Ipecac could be the same thing. So I said that okay, go ahead with it. I was sure that by evening probably the temperature might raise, because yesterday it started off around afternoon with a weakness, and then there was a evening rise of temperature. So today evening, what happened is that the temperature slowly started raising, and now it is what to say, 1 or 2. That is the call that I received a couple of minutes ago. And the prescription that I wanted to give was China, because all the symptoms, thirstlethness was there, nose obstruction, alternating sites was there, the follow-up, and the frightful nightmarish dreams were there, followed by the fever, and then all these things, cough, etc. So China, if you remember, after any sort of fear or fright, and developing such paroxysm, this one, what to say, periodic fever, China is indicated. That was the remedy that I have what to say, prescribed. I'll show the follow-up maybe in a couple of days in the group that you all are discuss. So that's the thing. Like, you don't get, what I want to convey through this is, in the first consultation itself, this is one scenario, right? In the first consultation itself, you don't get enough of information wherein you can confirm even a fever. Like this one is a compound fever, right? Compound fever, not just because the fact like it has a fever stage, cold stage, heat stage, third stage. We don't have any information regarding it. Who are the parents? They are homeopaths, both. Despite both of the parents being homeopaths, I don't have any clear-cut indications. So we'll have to go by past experience, or by whatever is available, and whatever our knowledge will help. Ipecac is also a little bit capricious. If you can check, Ipecac capricious is there. Why Ipecac? Why I give Ipecac is for this reason. because the child didn't know that she wants to have food or not. When I asked in the day today, she said that खाना खाऊंगी कि नहीं खाऊंगी पता नहीं, प्यास लग रही है मुझे, एक्चुअली पानी की बहुत जरूरत पड़ता है, but mother had told that she has not taken water, so I had to ask her again, like ठीक है पानी की बहुत जरूरत पड़ता है, आज कितना जरूरत पड़ा, आज तो कुछ लिया नहीं मैं. That's what she answered. So you have to take capricious, right? So that's why I continued with Repertory, and then later I came back to China. Does China has capriciousness? Yes, it does. So that's how we get to the further totality. The symptoms that I have mentioned, you can repertorize and see, because time is getting over and I have not covered enough of cases, enough of this thing. So, but this is one scenario wherein you don't get too much of information and you don't know how to go about. A few days ago, there was a patient who said that since 1 week I have hoarseness of voice, along with cough, and I have used allopathic medications. And what should I do? And this is the only briefing that I got. Appetite. Appetite is okay. This is like he was referred to me by someone, and all that I had was like I can probably take a picture and show it to you. 5 lines is what I had about him. 5 lines of information is what I had about him, and I had to prescribe. So what I did is the same thing. Go with whatever he has presented, and then ask for further more details, whichever could be collected. The remedy that was prescribed was carbovich. Yeah, what he said is, I have cold and Organiser, sneezing is there, and there is hoarseness of voice. That's all. There is no pain, no nothing. Cough is occasional only while talking, and no fears, no anxieties, because it is COVID season, and he has not been responding to any other medication since 1 week. I had to ask this question: were there any anxieties? He was very hasty. His wife was very hasty, and they were like they had to wait for a while, but they were asking time and again, when are you going to reply? And what else I had is like appetite was normal, thirst little increased, bowel movements normal, good normal, sleep good, and sleep is refreshing. This is all the information that I have got. But with this also, you just check with it. You can confirm that the remedy is Harboach. And it worked, had to be repeated for 3 days, and it worked. Here, the actual symptom that he mentioned was only hoarseness of voice. So, hoarseness of voice, when you have done it, when is the hoarseness of voice? It is during the cough, right? Along with the cough, let us say. And then there is cough, there is cold, there is sneezing. And the cough has a modality, right? While talking. Yeah. You don't have any information whether it was correctly or dry in the sense. Yeah, it was dry. So that was also occasional. We can say the sudden paroxysm also. And what else was there is like thirst. Thirst is a very large rubric, 870 still this thing. So what else I did is I asked for his tongue picture, and I actually don't have the repertorization, but the remedy prescribed was tablets. You can see what all it covers. And based on his hurry, haste, and also this one, he had been given allopathic medicine which didn't work, right? Was not responding to anything. So that was one thing. And probably the video chat that I have that made me select this remedy, carbo, veg, seeing the tongue. So what I mean to say is, most of the time, the repertorization is intuitional. That can also happen. So then what is the use of a repertory, and how are you going to learn repertorization, and how is it going to help us in repertorization? How is it going to help in finding a similimum means? Yes, it does help. How? Let us see. So, like, I just wanted to mention how difficult sometimes the case is. Like, if people quite often don't have anything to express, like how far can they tell you, like, they are not aware of themselves, like, this is the complaint, how should we express it? And we as doctors, we are not in a position to push further and ask for symptoms and prescribe it. Some people say, like, I prescribed it because of through my experience. Some say that is given in so material medica. My teachers don't, my sir don't. It probably sort of also gives you a confidence, like someone else did, so let us do it. So this is going to be short remedy because this is very specific. We'll give it, and repertorization is going to not going to help, and we go in search of several methods. This and that, or this particular doctor is very successful in treating so and so cases, so we'll go to him. This particular doctor is treating in this sort of cases, so we'll go to him. All these things come in. The problem, where does the problem lies, is errors and mistakes. It is both from the physician side and from the patient side. One is the language as such, the language that we use, and the language that is in repertory, and the language that the patient uses. It's very different. And that is one problem. Like, if there is an example, I think we could have done it. I think I got bored and went ahead. But still, we try to see some of this. How many people are there, or people left already? Or is it interesting or not? Can I see how many participants are there?
Yes, sir, there are lots of 100 plus.
So I think I'll take a little more of time, and I'll explain, because
Yes,
we have
sir.
not yet actually reached this. People, whether they are willing or not, let us. Are you people willing to wait for a while and listen, or is it not going well?
Yes, sir, you can continue, sir.
उनको भी थोड़ा पूछ लेते हैं, भाई
हाँ,
आपको समझ में आ रहा है या ज़्यादा देर, क्या बोलते हैं, जल्दी जल्दी से बोल रहे हैं या समझ में नहीं आ रहा है, या कैसा है, जरा आप लोग भी बताएं कमेंट में कि
यस सर, चैट में बताइए बाकी लोग।
क्या करें। पहले I'm just showing the problems that are going on, then we'll go into actual things. Like, every case is, the first thing that I wanted to establish is that there are no set methods to approach a case. There are set methods for repertorization also. There are whether the cases are easy and difficult. ये तो मैं यूं फटाक से कर लूंगा, वो कर लूंगा बोलते हैं, पर इतना आसान नहीं होता है जब हम बैठते हैं क्लिनिक में. Many people, I'm sorry for the Hindi if someone else from other parts of the world was saying. What I mean to say is that, not every day when we see actually in practice, every case is actually difficult. It's not that it's very easy to treat a fever. I will just give ferrum boss and it will take care. I will give this one arsenic or asthma, it will take care of this thing. That is not possible always. I will go ahead with rust of some time, it is going to help. And we obviously try, everybody is a trial, right? To upgrade themselves, to understand further, and to have a edge over things. And we do approach repertory because it's not helping also, like giving the specific remedy again, it's not helping due to, let us say, financial reasons, or for the compulsion of losing the patient. We may even try a couple of remedies. But again, what happens is that we don't understand which remedy works, and it doesn't help us in treating other people, treating furthermore new cases come. Or it can go on for a while. Some people, they try a couple of remedies, 2, 3 remedies, but how long does it help? It helps for a while, and then when it doesn't respond, one has to again look these combinations. That's how these combinations doesn't help in quite longer periods, right? Or even specific doesn't help in longer periods, right? And we obviously have to rely upon the totality of the symptoms. So the totality of the case, that what are the hardest to it in the sense? One is to the patient when they are not ready to tell, and especially in some of the cases they are not ready to uh, express. Yeah, video is hidden. I'll open it off. I'll just see. And we should interact with the patient. We should bring out the things, and we should what to say. We should construct a totality by understanding or by making the patient to speak out in such a way that we make a logical finding to it. So one of the hurdles is the language itself. Like someone said that, sir, delusion, like someone is beating me from behind. That is a delusion, right? Delusion, someone is beating from behind is what we have to actually look for. Delusion, someone is behind, delusion being persecuted. This is the symptom that has to be looked at actually for what she has asked. So, like you can see, whether you don't understand what to do, you don't know how to do, दो चीज आपको पता है ये delusion है. First question, someone who asked, right? I forgot the name, but she has asked, कोई पीछे से मार रहे हैं तमन्ना, I think. So you can search this way. First thing is that there is someone behind. So delusion behind, you put it, you will get to see what are all the rubrics over there. So someone is, something is behind me, that can be considered as a large group. You can take that. And you can see here, delusion imagination, written that he is being. So there are 6 remedies to it. And you can see some of them are new, but then you also have the traditional old remedies. Hello, Secretary, oh, complete. Like someone is beating. And Ryan is also having it, and Alex is also having it. So it's not that easy, that difficult to find a symptom. Like someone is beating, you just put it as beating. If you want to further enhance this, like someone is coming and beating is like a sort of, it's a delusion, right? तो कोई मुझे मार रहा है, मारने के लिए आ रहा है. It's also like delusion of being persecuted. So you can see, someone is behind me, someone is trying to beat me. That is for the broader perspective, you have this one. Can you people see, or am I not sharing the screen? Yeah, so that is this delusion persecuted, that is. This can also be taken, and delusion beaten is there. So you can take both of these as for reference. So the language, or we have to have a specific grip over the language. But even if you don't have, it's not a problematic thing. We can just go with whatever we know, and you don't even need to type a lot of words. You can just put ELU and you get it. Okay, that's how it is. And there is always Google, right? If you are not familiar with the English word, you can Google the word with सर मुझे बहुत संकोच होता है करने के लिए कोई बोल रहे हैं, so what would you do? Google it. You'll find synonyms to it. Hesitate. So go ahead. And hesitation, does it have? So here it is. A person hesitates. So that hesitates is like what? कब hesitate करते हैं? कब संकोच होता है? जब हमें confidence नहीं होता है, when we don't have the confidence, or when we are doubtful, when we are irresolute, then we hesitate to do something. Then we hesitate to say something. And then we hesitate to speak out something or do something. That is hesitation. Some coach, how to get into this one. Some coach says, this is how. Like, you want to, if you say that language is the difficulty, if we see that language is the difficulty, we can obviously use the tools that are available to us, and we can go and find out specific. It's as simple as that. And or repertory, the complete repertory or any other repertory does have all those words, synonyms, and in fact the cross references will obviously help. Some of the cross references might be missing, like very little. Every symptom has a cross reference. Like here, see, hide oneself desire to do. And you can see there are other cross references too. Humidity, public appeal, reserved, ransom. All those things are there. So the language hurdle is one thing that you need to cross over. Terminology, again the same, almost the same. The terminology that is used in materia medica may not be used in what to say, repertory. Like I have intense craving. So where is sir craving? दिखता है कुछ नहीं दिखता है. So cravings, where do we see? Desires and aversions. So I have craving for pickle, and we type craving for pickle. Nemila. We won't see it because that is not there. What we have to see is, so you get it. So the terminology, the word differences in materia medica and in repertory makes it little difficult. But then you see, craving is something that was used in old terminology. But desires is more apt and it is helpful. So even if you don't know, here it is, right? Craving. So cravings is under desires, cravings and desires. That's how it is. So you go to food and drinks, and then you see cuttlefish desires, acid food, aggravation, amelioration, alcohol it means aggravation, and then you will have amelioration, desires, aggravation, and all those things. Even that has some roots to it. Alcohol brings aggravation in the morning, hangover, all those things are there. So desires and aversions is where do you see this? You see it in the desires and aversions section of food desires and aversions. But you won't have it as a craving. That's one example to it. Whatever I could recollect, I am telling you. But there are several other things that what is in materia medica, the terminology, or in modern medicine, some terminology is used, you may not be having. The other thing is impatient. Like the patient is sitting in front of you and you are struggling to find out a particular symptom in it. And what would the patient think? That is a sort of great embarrassment, right? And then we have doubts. Like I said, there is this rubric itself, right? Has it, what's it? Delusion, bidding. So in this one, see, whether this is reliable, this is the symptom is very peculiar, the symptom is clear, and it's a reliable symptom. There is nothing to worry about. But some people would say, no, 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 this has so many new remedies. If there are some of the delusions where only the modernly proved remedies are there and not nothing like old one. Like this data A, delusion, beautiful, wonderful, urination of all things are delusion. This one is delusion, imagination, beautiful, wonderful, atmospheres. Has two remedies to it. One is Datura and one is placenta humana. Well, Datura is from Allen's, not even as like new remedy, old remedy, but we have never used it, right? So we're like, it's no lesson remedy. How would we use? That sort of doubts comes. And for this one, let us say, there is this one, Salix Fraxis, which is a new remedy, and this one is sickness. This is again a new remedy. But then you have aloe in it, and you have bryonia in it, and you have elax to it, and this one is Pyrex auris, that is rose and balm. So that is again a new remedy, right? But still, there are some of the rubrics that have old as well as new remedies, which should make things clear to you that everything is reliable, and that it is perceived, and that is why it is present out there. And if there are old remedies, which is good, it is good because like a remedy like aloe, how many rubrics are there for aloe? There are 5,818 rubrics are there. It says there are several confirmations to it. I'm not taking the separate thing, but you can see the repertory has several functions. Like you can see which one is a confirmed symptom, which one is a complete symptom by this. So you have, what I did is I'm searching for those symptoms that have remedies. So I am searching for those symptoms of aloe that are confirmed, that are on the highest grade, that is 3 and more. And also, it is more complete, like it has at least 2 to 3 attributes to it. And how many are there? 567. If you have to search for any new remedy like Criticum vulgar is nothing but wheat. You don't have anything because only the provings are added, and they, so the only proving information what we have is either single grade or two grade, but it has 5,000 symptoms. It is one of the new age remedies and has a greater importance in today's practice, and several cases get indicated through this remedy, which is also like I'm comparing both this Triticum vulgare and aloe because both of them have around 5,000 symptoms. Aloe is a very old remedy but doesn't have too many symptoms, but this Triticum has 5,000 symptoms, which has not got too many confirmations. But which one to rely upon, whether we should rely upon Triticum or not? Aloe, of course, is a well-proven remedy. For many, they don't use it for. Actually, it is indicated not just for the what to say. Aloes can treat several complaints, not just the hemorrhoids. You can see aloe is well-proven remedy for what sort of clinical conditions it is. Aloe can even be indicated in tuberculosis. Aloe can be even indicated in cancerous affectations. You can see the reference here. Who has mentioned it? Andre Saine to his Materia Medica project, which is the he is digging material from the past, from particular authors like what to say, Ipe and all, and that is there. And then one Ismail, he has presented a case. Ismail SM, and cancer, in the case is mentioned. You can go through that. This is how you find the reference to it also. So that's how you get it. Even in apoplexy, this is indicated as herring, right? So in clinical conditions, also it is. If you get to see, like, since I have opened up this. Let us see this also. Like, you can understand a remedy by looking at it also in a sort of reverse material medical time. Like what you are seeing here is all the symptoms that are covered by. Hello, Secretary. Now you want to see the symptoms that are produced by the first thing is that whatever is related to eye comes up, and we see there are several types of headache with several conformations of aloe, and you have it, and there is eye that is related, and the only eye symptoms, like if you can see, there is a very particular symptom to it with lots of remedies are there. This is like closing an eye. You want that is that in there is a desire to close the eyes during headache. This is one of the complete symptoms because eye is one location where someone wants to do something. Why? Because there is some other affectation where it is located. So you have a location, you have a sensation, or you have a during this makes it a modality conformity. Eye closed must is a modality. And you can see there are eruptions, there is heaviness, there is even hemorrhage in the eyes. So you get to learn the affinity of remedy this way also. But if in case you have a case where there are several symptoms and all these stuff put together, how would you confirm aloe? Like there is a headache, there is eye affectations too. There is something to do with the respiratory system. There is there is tuberculosis, and they have produced chest symptoms and cough. Aloe even has cough, different type of coughs, and also those symptoms. And you have put all those things along with that. If you find its main affinity, that is the rectum, the hemorrhoids, the type of hemorrhoids if they are present, it would be like clear-cut indication of that remedy. So that's another way of going about this case. So yeah, where were we? So doubts are there, and perception. How do we perceive? That is one thing. And theorizing, we obviously go on to theorize that this remedy is not going to work because it is a plant remedy. This remedy is a superficial acting remedy. How is it going to act, even though it is covering all the symptoms? These are the confusions. If you are practicing on veterinary medical knowledge or on a specific, you don't even need to look into the repertory, right? So sometimes the own perception, own doubts, and own theorizing also, and overemphasizing on what we know, forgetting what we do understand, also makes us not to reach the proper this thing. Like I want to take this symptom, this is not present. But this remedy is this particular rubric should have only a couple of remedies, but there are lots of remedies, so I am not able to find. These are all like you are escaping from. And there are also several misinformation, several shortcuts, several disbeliefs, and what to say. I have put it as enthusiasm here. What I meant to say is over enthusiasm. Some people like they don't want to go with regular things. They want something new, something odd. And someone recently had a case where everything was fine and it was clearly indicated of a well-known remedy for pneumonia. That person wanted to try out some remedy which was like what to say, mentioned by a stalwart in COVID or COVID related. So it doesn't help that way, right? Just because someone has said that you can test, but where can you test? You can test only when it is not that trivial, but every case has to be done with the dedication. So experimentation doesn't help, and enthusiasm kills the learning. So that also might lead to mistakes. Like one sir has taken this one particular symptom and he has analyzed this, so we will do this. I have seen some people who have used a particular software where you can search for related. You can search. There is a proximity search. Even in complete dynamics, you can proximity search. Like you can say, like hip and knee or relatively nearby, but if you want to search for symptoms that has pain in hip, knee, and which are nearby, you can search for that also. And There are some rubrics like, see, for example, this is a proximity search wherein you are searching for pain, hip, and knee, which are nearby. And this software is capable of finding these nearby symptoms. In this, they are very nearby. And in this, they are actually distant apart. You can see here, it is divided by this and actually related symptoms. But there are certain softwares which can make a rubric out of these symptoms. While making such things, be careful. Like one day, one person said that they have dreams of getting raped, and probably that was not there. I don't think so. It's there in any medicine. So dreams of being raped, not just raped, raped by ghosts. It is not there in veterinary medical. It's not also there in repertory. So if you go to one particular software, I'll name it. What's wrong with it? Now it is called as Synergy Homeopathic software, and earlier Mac repertory. If you go into reference work, it is earlier this thing. If you go and search for dreams, rape, ghosts, there are some 5 to 6 results that come out. So, but the point is, she has taken stramonium or something. But where does it occur? The first line, ghost, is in first paragraph, and then rape is in the fifth paragraph. And the symptoms are of from a prover, different provers, and they are not related in one instance. So that way you have to avoid, like while using softwares, being over enthusiastic and doing wrong things may not help. Like there is in this also, like you can cross rubrics, but crossing and combining should also have a logic to what you do. Like we said, cough dry is there, cough dry lying down on right side is there. That right side is aggravation, and cough dry lying on the left side is amelioration. So this is like you have a cough, which is a complaint. You have dryness, dry cough, that is, it is non-productive, which is a phenomenon. And you have a side modality, is lying on the left side is a, what to say, lying on the left side is ameliorating, and lying on the right side is aggravating. This can also be found like lying on the painless side, amelioration, lying on the painful side, aggravation. So these are like, you can devise it. I'll show you. If you see cough dry, how many remedies are there? 570 are there. So we'll narrow it down with some of the particulars. That cough dry, lying, right, aggravation. There is only aggravation, there is no amelioration. What shall we do? But then aggravation is what matters, not the amelioration, we can say. Or we can look this way. We will go for only cough. There is one cough lying on the left side. You can go for a very general, lying on the left side amelioration, lying on the right side. We'll just leave it. So why is this needed? Do we need to do like this or not? In the sense, when there are like very less remedies, this one is 8 remedies. So we are not sure whether it is this. Make sure that we are clearer we have at least 4 attributes to something that could give us a clear idea. We will have to do this thing. So lying on the side, aggravation, painless, not on the affected side is in Boger's side of the pain lying on the aggravation side. So this is opposite to what we are searching actually. But then you can see for the pain, you can just go to the side this. So here, Maxall is covering almost all these things, and amelioration on left side doesn't matter, right? Of course. Generally, lying on left side amelioration, you can. Usually, you can see or you can understand lying on the left doesn't have to lying on the right side aggravation. It's not there, but left amelioration is there. But for cough, if you have seen, you don't have what to say. Lying on the left side amelioration is not there in terms of this thing. But then when you have a relatively larger rubric, you can be sure of the remedy rather than relying upon on this thing. For example, here all these things are well proven remedies, and quickly they are all covering these things. This is how you can make a symptom little complete, and you can be little specific. Let us say this person also has irritability, cough during. You see, the totality is slightly changes, and if you see where it occurs, most of the things. So, how can we do it like Medsol? Does it have or not? Whether we can confirm? Because Brainia is not covering one, Medsol is not covering one, but the lying on the right side is more specific as it is a modality. What shall we do? We'll see this. We just take the irritability. There is one thing called mild cough during. So you can check here irritability or anger, if it is present, or you can take it, or if it's not there, you can leave it. So, but then irritability is again covered by this thing, right? So that's enough to confirm with Medsol, and rather than going with Bryonia, which doesn't cover these things, you can go with the Medsol. So sometimes what happens is that with with a small addition of a small rubric, what happens is it changes the totality. Now let us remove Medsol is again upwards. So these errors do happen, and how do we further do it in the sense? This is where you need to have a particular approach, right? So what is that approach in the sense? What are observable is like you can go for those observable symptoms like tongue is rooted in the center. This is one observable symptom that you had taken. So along with this cough, right side, left side, aggravation and aggravation and all, is also very thirsty. Extreme thirst is there. How does the severity of the complaints get expressed or intensity of the symptoms get expressed in the rubric is through certain words like this, like thirst, extreme, extreme. Like you can say rapid, There are rapid complaints. This is to express the intensity of the complaints. There was a question that was asked recently, like how do you get rapid? So that was the answer. So you see here, when you go on to add some more symptoms to it, like person only told that he has cough lying on the right side, then you build upon it. Like how is the thirst? How is the tongue? Show me. And you can ask, how is the bowels? The stool is green. That's what he said. Some people they don't remember all these normal things. You can not ask, but then you can go for physical examination. You can auscultate the lungs, and you then auscultated the lungs, and you found that there is wheezing. You add that. And what else could make it furthermore better? Or what time is it increasing? What time is it higher, lower in the sense? Cough is more during just the morning and in the evening. The patient says, you add this thing. And you have some more. You see Metsol coming up. And still you are not satisfied. You want to go further in a sense. We can add what else is happening. Like has it affected your day-to-day activity? How you have been earlier and what has happened since. Actually, I'm very irritable sort of person, but since this cough I have done. Let us see if dullness during cough is there. You can add it. Or you can just add. You see, epicock is coming up. So we are actually trying for this irritability cough during. So again, there is a change in it. And Metsol has come down, but both of them they cover this thing. So what we have been doing right, we are trying to confirm, we are trying to build up, and we are also getting confused in one way. In another way, we are actually trying to be very clear and want to be very sure, and as a remedy that can cover all this thing can be prescribed. That's what we want to see. And so what will you do? We'll do this thing, whether it is aggravated with cold or warmth. We'll go with the generality. Right? So again, Deepika Metsol has come up and it has come down, and this is it. But what have I been doing? Like, does it have any logic of construction to this in the sense? What I have did, let us see. This one, mind coughing while is a concomitant. Unless coughing during is also a modality. Pallav Tamanwala sir, how to add a rubric to the this one analysis is you enter the rubric and then you select it, and on your keyboard there is an enter button. You can do that, or else you can right click and you can here add rubric to analysis. You can add it. That's how you can do it. So that's the thing. So adding in the sense with this, it is very easy. You just go on click on this one, convulsions. If you click it, it doesn't have any remedy, so it doesn't get it. But whatever, it's like faint text, continue. I have entered the button enter is there. Okay, coming back, what I have did is actually irritability is the trait of a person, and the other things are couple of them are modalities by circumstance, and mouth coated is a general personality which could determine his generality or a personality. Thirst, which is extreme, that is there, which also determines the generality of a person. And then you have particular symptoms and a time modality of time. And let us say cough, dry, lying is again lying on the right side. You have side to it, and you have another amelioration or aggravation. Sorry, I have done a mistake here. But let us not go into the detail. I said that on left side it is amelioration. Sorry for the mistake. But then you have modality of time, you have modality of circumstance, you have the personality, you have the generals, and this is what Boninghausen's actual method is. See, actually, I went through the web yesterday, like whether topic has been covered or is it something new that I have been doing, that I have done. It's all there. Several people have written. It's all in Google, and I also heard a lot about a lot on YouTube. So I wanted to do something different, but of course I didn't have too much of time, or I didn't have what to say, time to prepare or select some cases to show you. But then I would like to emphasize certain things. If you want to elicit case, you need to be clear at your basics. You need to add to it, and then you will get to it. But how to reach a similimum in the sense, you will have to have a mental approach to it. Like I actually synthesize this case, right? So it may not be helping you to understand. Let us go to the real cases that we have treated, which have got some, say, recently. So here are some of the cases. This is like this person, he has got cancer in the bladder, but he doesn't believe that he has cancer. And always comes and says that I am unable to pass it. I'll show the complaints. These are the presenting complaints. Delusion that he is well, and what happened is that his son has lost a job, and he has told him, with whom he doesn't speak too much. So he has got worried or angered. Then this has happened. Like they didn't come for the treatment of cancer as such to me. The main presenting complaints was this: wall-like stools, and they were very scanty, and urine was bloody, and it was dribbling in drops, and urine was red. That these are the complaints: scanty urination, dribbling in nature, it was red, and then the stools were like very small. He said that it was like that is like a shit of a rat. It's only that much. So this is what they came for. So in whatever was available, these things had to be taken. And actually, what happened is that some of the extra information was given by attendants, like brother lost a job and he was like disturbed and we got the news. That's what his daughter said. This gentleman is 80 years old. So he was like, due to this urging desire, he was unable to sleep. So what was the prescription here is like, we could go with pulsatilla, opium, or tuja because these things are there. And very simple logic that has to be understood. Arnica is a remedy that actually has ripple-like stools because of enlargement of prostate, as written in Metinio. Also because of retroverted uterus, females. But arnica, why there is a mechanical obstruction because of the stool goes this way in arnica. That is one thing. So the stool is not passing properly because of, let us say, the polyp in itself, the cancer, which the patient is not aware or not ready to say, only that and so saying. So there is a mechanical obstruction. So we try to perceive in that angle. The other thing is like he says that I'm well. Whenever I ask him, how are you? I am actually well. The only thing is that I'm unable to pass my stool and this urine is dripping. Otherwise, I am perfectly fine. I'm not disturbed. Even he didn't mention about the quarrel with this. But this was the first consultation. So then again, he came back after a month. Then like he was always contradictory in nature all through his life, and he was discontented with things, and he was not ready to be pleased by anything. But what happened is that after Arnica, he was able to pass urine, and that's why he came after a month. First consultation was a very acute one. So he came, and we gave. There were several remedies. Initially, I thought that it was pulsatilla, but anyhow, he was an old man, and this physical obstruction was there. So it was not just a prescription that was made because what I said, like obstruction is causing the constipation or bowel stools, but it covers the pathology, most of the pathology. Of course, it is not covering the bladder cancer. The delusion is there, all these things are there. So, first to remove the presenting complaint, which is acute manifestation, we had to go with what is there. I gave it and it worked and it came. And then again, he came back for the same thing. And I had put the symptoms here. These are the presenting complaints then. And obviously, because of the polyps, there is pain during urination, the dribbling drop by drop. The earlier he came with the blood in the urine, all these things were there. With after arnica, it reduced and more. That day, I was asking him, "How are you? How do you spend time?" And what? He said that I read a lot. I was a lawyer. I read lot law books. I also read all the papers and things and so on. So I write also. He said. Then I said that, oh, is it so? And okay, you write me a certain thing. Let me see your handwriting. I said that I gave him the case sheet. What he wrote is, in his own words, I am doing perfectly very good. The thing is, Arnica again has this. Says he is well. Even when there is an accident, there is a fear that fear of being touched, fear of being hurt. Even at that time, they say, I am well, don't touch me, don't touch me. So similar, that is one state that is, you can see. Even in delirium, he says that I am well. It is because of the hidden fear. They also have aversion to drug. This particular gentleman doesn't come to consultation at all. He says that I am fine. I don't want to come. But is this is constitutional remedy in the sense? No, it is not. But then it clearly expresses the state of, like I'll go back to the past history. Like after before 10 years, he had problems with urination and then passing stool. So he has been taken to hospitals. They have found some sort of obstruction, and they had put some catheter or pipe or a rod into it, and they have. This is how he mentions. He never says that he has cancer, and he had cancer, and they had done all this. He had all these pains, and all. So he was doing well and all those things. But recently, what happened is that during the Corona time, he couldn't go. He's 86, but still moves around, comes very tip top. I'll probably show you his photograph. And he's very like restless person, and wants to always pick up things, pick up fight with wife and all those things are there. So this man was little emotionally disturbed, and then he got this one, say, aggravated. and that's why he had to come. But even in the first consultation, he was like asking, when will it go? How long should I take the medication? That's what he was asking. So this is the patient. See his posture. Because of the pain in the urethra and pain in the rectum, he is unable to sit comfortably. He's sitting on the edge with his leg like this, and this is his appearance. But he is very obstinate, very strong, very determined. And what could be his constitutional remedy? Like, it could be anything. He has been like very cautious. He has resigned his job, thinking that these things, like what was it? Because his office was to be shifted to some other locality, he didn't want to leave it himself. He has always been that play safe sort of person, and has become very obstinate. But now, in general, his state is this. So, whether we are going to cure his cancer or not is secondary. But first thing is, he comes only when he is having this acute trouble of not passing the stool or not passing, being able to pass the urination. He has come day before yesterday also. Because he doesn't come when he's fine. When I ask for follow-up, he doesn't come. And he doesn't say anything. And whatever I have got, whatever I have shared with you, it has happened through these consultations. Like, I had never got full information of his past. In fact, even present also, he doesn't let them speak, let the attendant speak what he speaks. So bits and pieces of information is what we get. So this is like cancer being the diagnosis is not the difficulty, but the people saying like what to say. The patient themselves, the expression of them, the information that we get from them is very good. But despite all that, like I have showed you here, uh, he says that he is well and he has written that he is doing well in the second consultation. Confirms the genius of the medicine. So we only need to concentrate on these things, and in the further follow-ups we get to know whether we are right or wrong. And that is what I wanted to emphasize. Like, you may not be right in the first prescription, but what happens is that follow-up is the one thing that gives you the opportunity to know whether you are right or wrong, whether your prescription was right or wrong. And follow-up is that determines your further action. Let us say you had some set of complaints and you have prescribed something. It is your duty to prescribe. And with all the knowledge you have and with all the possibilities that you have prescribed a remedy. So what happens is that it is not like it is not going to work. When you have worked out and when you have prescribed, it is obviously going to work. But if it is a partial remedy, you will get to see a new set of symptoms. Or if it is a superficial layer, if it is a very superficial thing, or if it is acute state, it would remove all those symptoms and bring in those previous symptoms that they had, or you will have to treat the original state of the person, which you can afford to if the person is willing. In this case, the patient is not willing for any treatment. He comes only during the acute case, only during this pain. This is I have mentioned this only to emphasize upon two things. One is how the genius of remedies, how they get expressed in the person, and what to say. Second one is like follow-ups. They help you in determining the further progress. The third most important thing is that if only your patient is ready, you can cure him. If they are not ready, you cannot. Many a times, patient they are in a hurry, they are in an impatience, and they just come for certain thing. You are supposed only to cure that because that is first thing that they expect. Of course, it's our duty to look into other details and all those things. But for a complete cure, for a condition like cancer or anything like a difficult disease, patients should be willing. Patients relatives should be ready to have the patience and to see through. Many a times, this is what gets missed. Luckily, this case is going on. Sometime I would like to present it. And actually, I work on a couple of computers. I cannot check it. So this one is like one of my friends. He has got admitted in a reputed hospital because of testing positive to COVID and saturation points coming down to an extent. And when I spoke to him, he was like, his voice was trembling and he was weak. And he already got admitted and he got discharged. But when he got discharged, these are the complaints that he had. By the time we reached home, these are the complaints. Like he had bitter taste in the mouth, dryness in the tongue was there, coated tongue was there, which I always collect. And then there was pain in the knees and fear of death while coughing. He was like, he has seen a couple of people dying in the hospital. And that fear of death was there. And then he has taken lots of steroids and these things. And he was during convalescence period. And still he has cough. And cough with the cough, he has fear. And he has the tiredness. He cannot talk for long period. He cannot walk for long periods of time. So he just wanted to consult. So after the prescription was phosphorus, and then of course the other follow-up is on the other computer. So after 2 to 3 days, he was fine and he was able to speak with lots of vigor and this thing. What happened is that all the complaints went off, only back pain was there. And while walking, he's feeling short of breath. The reason for it is the consolidation of the lung. I think I have taken a lot of time. Probably I have not done it in a structured way. I have missed several things. But that's how it is. Homeopathy is too vast and not everything can be covered in one day. So to reach a similimum, what I want to say is that you will have to work again and again. You will have to work on whatever is available with you and then fill up with, like, what to say. Your case taking should improve. And there are several topics that has been asked, how to bring out the mental symptoms of the people. I would like just to finish it in a short while, because how to bring out the mental symptoms in a person is like, first observe life. That is what is very important. You have to observe life and have an understanding. And the person has come and sat. He says that I'm fine. I'm an open pepper. I don't have any problems. I'm happy, go lucky person. So you don't get any mentals. That is one thing that you say. And how can I start with this? So one thing is like, I'm very contented. I'm a very open pepper. What is there to say? I am a very simple person. This is how a person says. So some people are like very calm. How to make them speak? So if you observe life, first thing is that a human being has interaction with the immediate relatives of the person with whom he stays. So go for it and ask for, like, how are your interactions? What do you do when you wake up? And how does it go? Then you get to know what they speak with the parents or with the friends, or how they do. And then they go with the interaction, the secondary interactions that happen with whom? With the places we visit. For example, like we go into bus or auto or to the or some other means. So those people, or the ones who are driving, those who are traveling along with, those are the people we interact with. Let us say that is not a possibility. We have to ask for where do they work, what sort of nature of work is there, whether it is about communication, or is it like a group work, or is a single person work. Like, let us say a homeopathic doctor needs to talk a lot. I'm not someone who speaks a lot in person. But while explaining, I have to speak, right? While I have to explain my patients, while I have to talk to patients, I speak a lot. So in terms of this, what we have to do is like emphasize on that thing, like at work, what do you do? How do you communicate? Is the communication proper? Are you able to convey your things in a proper way? Then a person might say, see, actually, sir, I say something, people understand another way. People usually get angered with me. people do this, people do that, and all that comes out then. Like that is how we can enter into this. That's what I want to say. Then other, like, you can obviously ask for other sorts of communications that are possible with the person. You have to imagine and ask for things like, if it's a student, how do you begin in school? How many friends do you have? Do you have enough number of friends? What do you do with your friends? Do you talk or do you don't talk? So bringing out things in the sense, this is one aspect. Other things that can bring out talking in the sense, the person has not spoken about anything, but you can catch hold of something that can affect a person. Like I say, current trends of things. You can speak about whatever current things that are happening around your locality, or in the nation, or in a society, or regarding a festival, or regarding anything. At least people will have some sort of opinion. Even if they don't, you can go and ask, like, what did you do for Ganesh Chaturthi? What did you add? Did you celebrate this way? Did you celebrate that way? Two things are possible. One would explain to the entirety what they have did, what they did. The other one would ask, why are you asking? Like, I just for information's sake, like, we can say so. But we can obviously make people speak, right? Like, how do you make, let us say, a male wants to communicate with a female? How do you flirt? How do you make someone speak? Or let us say we just want to speak to someone, or we are traveling in the bus, we pick up some topics, right? That's how, like, after finishing the case taking, while you are writing or doing something, ask. And then also there are other things, like sometimes you need to ignore the person. You should behave as though you are not listening to them, which makes them speak out, which makes them to bring out an emotion. Doctor, I am talking to you and you are not listening to me. It's one of the possible sort of reaction. Doctor, please listen to me, can be one thing. And most important thing, like, you have to be observant. When is the person talking to you with a free hand, making gestures, or when the person is closed, holding his hands, folding his legs. Many a times, people, when they want to express, like recently, I had a patient. He came when he was explaining about his complaints. He actually came very near to me and pushed his chair, and he came nearer like this. Like, I was there in front, and he came near it. And he was explaining about. After a while, when we need to speak about his son's case, he went like this. He went behind, and then he has put his leg over the leg, and he spoke like this. There, he was. His thinking was about in a, like, a decision maker's position. When he came in front, his process, his thinking was like, his complaint has to be addressed, and he wanted to be nearby. He wanted to see what I am writing. He wanted to check what I am repertorizing. And yeah, of course, I want to say one thing. Sir, how do we repertorize in front of the patient? Yeah, of course, you can repertorize in front of the patient. You can make them sit beside, not in front. And when they are sitting beside, you can do this thing. If they ask, you can say that this is the symptom codex that we have. And the more information that we have, the more we can get it. Like, you can in fact show the symptom, like you have mentioned, right, sir, that you are, what to say, you have this sort of pain. Like, see, you have this many number of remedies for this pain. So you have to be more specific of what time it is causing you trouble, what by doing what is causing you trouble. Along with this, what is there? You can in fact show the material and you can educate your patient that way. So repertorizing in front of a patient is not going to be a problem. And of course, that enthusiasm or that cross questioning or that irritability of that person asking you, why are you doing? I am saying something, you are doing this. Do you even understand what I am saying? Or you don't know anything, or what you are checking in the book? If they ask, that is initiating some sort of this thing, right? Even if they don't initiate, you can obviously bring a person into conversation by doing so. So, like, some people ask out of enthusiasm, doctor, what are you doing with the computer? Or do you even need and all? So you can start the conversation somewhere, or you can, like, you have to, like, understand how we can make a conversation, and conversations lead to expression of this thing. Or you can ask, what are your beliefs? What are your disbeliefs? Like, today everyone has an opinion, right? And they speak about it. Like, let us say children out there, and they're not speaking too much how to elicit a symptom. Like, nowadays there is a trend. People watch all the Netflix series, this and that, and people do watch, right? So they would mention something like one kid who was in the 12th standard. He is lost. He doesn't speak to people. He closes his doors and he's doing things. He's attending classes. We don't know whether he's attending classes. He's playing games. That is the father's complaint. So when they ask, he says that I feel better not communicating with people. His father's fear is that he will get withdrawn. So when I spoke to him over a telephonic conversation, the thing is, he says that I find it different and find happy in a different world. What is his world? His world is the world of Pokemon. The game is there, right? Pokemon. And the anime things. So he's totally withdrawn. But if we don't know about what anime cartoons are, what Pokemon is, that we may not be able to converse. So I had to learn some things about Pokemon. I played him a song from Pokemon. There is a song, and then I had to watch some of the episodes of it to communicate with him. So we'll have to do such efforts. We'll have to like be updated to speak to these things. The other thing is that most of the youth nowadays, they are into watching series, right? It was not out of interest, but out of enthusiasm. I had watched a couple of series like it. One was the Game of Thrones, because everybody were mentioning about Cersei, the Lannisters, what is her name, Khaleesi, all these people. If you don't know what they are speaking, what would you speak? But then, like, what do you like? I like this thing. So you will have to go into this thing and see who is it. It's like recent rage, money heist was there. Like, let us say if you don't know who Tokyo is, you are not able to, you cannot make a conversation. Okay, we made an effort. I actually finished all the 3 seasons in what to say. I actually finished the season in one day, and then I could actually communicate with some of the patients who were relating or who were talking about money. It's like I can now, since I understand, Tokyo is the one who narrates, who is very unpredictable, who is um, very arrogant, and she has gone through several betrayals. The first introduction of her is like her mother is surrounded by police, and she calls her, asking her to come home. A mother can obviously protect her by giving some code word or something, or even if she can sacrifice for her child who has a life. She doesn't. And she all the betrayal of her, how it comes out in Tokyo is through the rebelliousness. Her she cannot remain in one place. They go into hiding, right? And after that, she wants a change. They come out. That's how they get caught in that. That's how it leads to second part. So you understand a personality. So when you understand a personality, you can ask the same thing about the person who is telling about this, or the people who are interested. This is one, or like let us say there is one Nairobi character, and then the professor. Nairobi is separated from his child, the Nairobi character, and she is thriving hard so that she can make a fortune and take care of the child. And how does this one, Tokyo, find out that Nairobi has a child? It's an interesting happening, right? All these things happen. She almost is a troubleshooter, and she takes care of things in the for a while, and of course she sacrifices, like all those things. So why is it relevant in the sense? If you understand these things, you can ask these people like, whom do you relate most to? Like, these are not characters. This is not just a what to say, money heist, or a money heist is not just an adventure or thriller. It has some characters and it has some past, and you can see the professor has had a physical illness, and they had a dream. His father has a dream, and they could not do this thing, and then he wanted to fulfill the dream. Berlin, we come to know later on that he is his brother, but he is very arrogant, masochist, sexual abuser, all those things. But you also find that he has some strange disease like trembling of the hands, and he needs things, and there's a progressive disease. He dies, and what else is there? But he sacrifices his life at the end. We think that he's the troublemaker. He will make a fortune. But he is the one. Who stands the guard and lets everyone escape, because he knows that he doesn't have too much of time. But see his nature, the desire for finery, his sarcasm, or his way of behaving with people, very rude, and sexual exploits. He has a love interest who is a male also, but he doesn't give up to him. He has married twice, And all we get to know that all the time he has got ditched and all. Being so manipulative, he got ditched and all these things. We get to know the variations of it, right? This nature of disease, a person dying with the nature of disease had these sort of these things. You also get to learn that way also. But if someone is trying to relate to that, you can explore the like nobody speaks about a person unless they resonate with it. Either they will be hating a person because of this they are interested and speak about it, or they like them or they speak about it. To make a person speak, you will have to take several steps or several ways to approach it. One way is also to do this. The other way is like currently the current socio-political situations, you can make a person speak by talking to that. And how would we get the emotion in the sense? Like I have been speaking, I have been hasty. Like earlier, I have been a little confused, right? If you saw, I got confused while explaining explaining the case because I didn't prepare. But that doesn't mean I am always in confusion. And I was slow initially. The slowness was because I had time. I had several thoughts in mind. I had to. I started off with it. But then when time is less, I have been hasty, right? But then still trying to convey. This is how we do it. And it's like a competition between the patient and the doctor. And these are the actually primary requisites. Like it is your case taking that is going to determine the technique. Is your understanding, your this ability to turn this thing into this thing. What to say? Simple language is what is all that you need. Since time constraint is there, I would definitely like to have some cases explain and do those things. Uh, like say in Tamil or Hindi or Kannada or in Malayalam or in any other language that I know, and then put it into repertory and do all those things. But time is a constraint, so I cannot do it as of. But, I would definitely look forward to making one case for one presentation. But in a gist, what I want to say is that it is case taking that is most important. You have to be very precise, and all the efforts that you put, the amount of time you spend in reading, the amount of time you spend in understanding a person, understanding life, understanding circumstances that would make a person behave in a particular way or in a particular put a person in a particular mindset. How the time, how the like there are certain factors that affect the life, right? The reputation, the ego, those are minor things. But very important thing is for now, for any time, is survival to earning. So earning, what does it bring? Money. Money and productivity is something that can affect a lot of people in a lot of ways. That is where you can explore them. Like one is very ambitious, wants to purchase a Audi. That again is about productivity, which comes from the head. One wants to be lazy and laid back because he already has lots of money. One doesn't have still things that he can do by manipulating. One is like always worried about what next because of the productivity. So there are certain things in life like which could affect a person on an overall basis. Like let us say Corona has happened to someone, and they have not too much of money and they have admitted in an allopathic hospital, and it is taking a lot of expenses every day. 75,000 for ventilation, all these things, and so on and so forth. So they would afford. They would in fact take a loan and help whoever is ailing, even if it is an old person. But how long? Once they are out of the money, they don't have any option unless someone is there to guide that. So you did whatever you had to do, and beyond this, if you do, there is no point. You will be burdened so much that you will have to suffer for entire life. So one has to obviously withdraw. You look for a lower facility. Like what someone would say is like the patient is under 50% of concentration of oxygen, but we are not leaving off any hopes. The person is conscious only. We'll try our level best the person can say. But in reality, one should understand, right, what is going to happen. So money, what I wanted to emphasize, money is going to cripple a person. An event of anything, any event in life like a marriage is a burden. Entire lifetime saving goes on. Some people work only on that. Money is one issue for some of the people and any family. And the other one is about settlement of a son. Marriage of a daughter, settlement of a son. and money is poured on it. The other one is like people when they are earning much, how much they can spend on lavishness, how much they can spend on the needs of their people who are dependent on them, like brothers, sisters, mother, ailing father. How long, how much one has to do, and when to withdraw. That is there. So it has to do with moral understanding, all those things, which is very wide. So all these things covered, when everything is clear, the totality comes up in a proper way. Maybe I had been over ambitious to try all those things and explain and this thing. Some might say you might have just shown me the cases. Even if it was a case, I think I would not have been able to cover or get justice to the topic by one case. It needs several cases. So if the organizers allow me, or if the people, if you wish to hear again, then I will make some cases and do it with this introduction. If not so, probably I will upload some cases. So that's it. I'm sorry for taking so much of the time. It started off very late, but I hope so. It has been helpful. I would like to know the views of people. You can write to me to my mail ID, or you can write it here also. My mail ID is you can write me here. Dr. Abhishek.
Yes, sir. Thank you, sir, for your session.
Oh, sorry for taking. Yeah.
Yes, sir.
You have something to present. You had some video, you said.
Yes, sir. We have one video from our collaborator, Complete Dynamic Software. I just want to go for 5 minutes just.
Repertory and repertorization has come a long way, and you can use these advanced features in your mobile device too. Now your clinic is in your pocket. Now anywhere, open up the Complete Dynamic software and start typing the symptoms of your patient, in this case fever and cough, and it will bring up the rubrics in the repertory. After you find an appropriate rubric for your patient, you can then long press the remedy or rubric to bring up the menu. In this case, let us long press the medicine and go to Materia Medica quick view. Here you can see the remedy relationship and the red line symptoms and the Borix Materia Medica. So here you can verify the medicine and its symptoms, is it matching to your patients or not, and then come back to the rubric again. To add the rubric to the analysis, long press the rubric and select it so that the rubric is added to the analysis, and here you can see it has been added to the analysis. Now you can also look at it with various views. Now to see the Materia Medica, you can choose Materia Medica and then the remedy name, and then you can also watch and read the different Materia Medicas and the symptoms of any remedies that you want to check. If you don't want to type, or if you make mistakes in typing, you can use the artificial intelligence provided in the Android phone to do the repertorization without typing. To choose the language of your speech, you can change the settings of your keyboard, and then you can press the mic on your keyboard to speak.
Shararat.
This tool and artificial intelligence is very important for people who have a tough time in finding difficult rubrics. Here, a very common rubric in the children's Shararat is used, mischief. So here you can reach the rubric with a great amount of ease. Let us now try this for a very common symptom of COVID and COVID-like illness.
बुखार, खांसी,
As you can see that with such an ease, by speaking it in your own language, the appropriate COVID-like symptom has come up in the repertory. Now you can repertorize this case. So I don't think repertorization could have been easier than this.
अवसाद,
So everybody is comfortable in repertorizing in his or her language. So here a very common symptom of SAD, depression and several other difficult mind rubrics can be searched with very ease, and this tool of artificial intelligence has proved to be a boon to homeopathy and homeopaths.
What do you expect from a repertorization software? Just relief or cure. Presenting most economic, easy, quick, accurate and result-oriented software. Easy like Google. Easiest repertory and search. Fast and powerful. Repertorize while patient is narrating symptoms. Result-oriented. Reliable information for sure, cure. Latest and up-to-date. Repertory and software are regularly updated. Multi-device, multi-OS. Keep your clinic in your pocket. Free and affordable. Lowest price, browser edition free for life. The most widely used software in the world. All of them are using Complete Dynamics software. Complete Dynamics has every tool you need to run a guaranteed roaring practice. Visit https://repertory.nambisons.com/.
So that's we have, sir, about the repertorization from the mobile also. We can also do in the Hindi language also. That's what the video said about.
Okay, I would like to hear from some of the participants if they were happy with it or they want to say something. You can write here just for 5 minutes if you have. I see 56 participants. Some
Yes.
of them have longer. So they are willing to write, or they can write. Like that's one thing. The other thing, if like you want to, if you could correlate and understand, and you actually want to see repertorization, which I should have done, couldn't do too much. If they are willing, I can do it through you, through the GHMC Bhopal, or I will do it through some other means on Facebook or something.
Sure, sir.
But I just wanted to know these people wanted to actually we do that.
So if anybody has any question, please put your questions in chat box.
Was the video quality okay with that, or is it like any disturbances with that?
Yes, it will be okay, sir. It is okay. Yes.
Dr. Ashmita, thank you for the comment. Like you felt it knowledgeable, good. Happy that felt it found useful. I hope so it was equally useful for others also.
I think.
Like one Pragya, I think otherwise I don't know whether she's online or not, but she was asking like whether to go with which repertory. The complete repertory is an ensemble of all the other repertory present, and whichever repertory is that, whichever symptom is that, that is obviously going to be present. Only thing is that the arrangement, the syntax of it might be a little different. So the complete repertory, a repertory like complete one, complete, would help you to use all the information from different repertories into one place. Like the software Complete Dynamics itself, which has complete repertory. It helps you to use both layer as well as पाठक as well as any other repertory. Like she has बोरिक में कर रही हूँ, पाठक में कर रही नहीं हो रहा, और सब information in a particular format complete में है. तो आप वो सब मिला के करेंगे तो आपको एक्चुअल में जो आना चाहिए वो आ जाए. Why there is someone is asking, why there is bogus analysis sound separately present? Bogus general analysis is something which cannot be converted or fit into the construction of a complete repertory or synthesis, because of which it has been left standard now, and that is why it is as a separate thing. Both bogus synoptic key and bogus, any of the bogus material, it is very difficult to be incorporated actually into a repertory. It is very unique. So that's why bogus general analysis is actually left alone. Dr. Abhishek, how to expand chat? I cannot see them directly. Yeah, now I can see. Thank you. Tushara, she says that session was very knowledgeable, and okay, thank you for that. Can that be merged with repertorization? Yes, a bogus synoptic key can be merged with the complete thing, but I don't think so. There is a necessity to it. Insofar as my experience is concerned, I never found the reason to merge bogus synoptic key into that of complete repertorization. So I just keep it with complete to avoid confusion. But anyhow, they are present in a different format. Since some people were asking, it was added on. That's it. In complete dynamics, now you have repertory also, separate standalone repertory. That's what the what to say, from the demand of people that has been added. Otherwise, you can just take one particular repertory itself, like a big one, like 10 repertory itself is enough if you want, if you have proper knowledge of it. You can go with it. The advantage of using modern repertories is that you have other information also from a different. Where this software is available, it is available on this website. You can download it for free. Dr. Tamanna. This is available on www.completedynamics.com. You can go and download there according to your. Dr. Himani Sharma, it was really informative and knowledgeable session. End of complete knowledge. Really, thank you very much for the acknowledgement. Dr. Abhishek, tell about your research project or what sort of work you carry out there. I'm just interacting with you.
Yes, sir.
I wanted to ask you over phone, but I can't ask you here. Like, what sort of work is being done over there?
Yes, as our Department of Medical Research, this is the first kind of a medical department for research in homeopathy in Madhya Pradesh. We are working on finding the sickle cell patients in the most privileged patient like Bega, Bharia caste. They are very endangered caste. We are working in 4 districts of Madhya Pradesh, that is Malla, Dindori, Shahdol and Chhindwara. We are finding much number of patients, and these patients are diagnosed first time. It is a very unique thing. After finding all the patients, we will case taking and repertorize the patients and give them the medicine along with the allopathic treatment as an adjuvant therapy. And let's see what we find in the results. Yes, sir.
That's commendable work. I look forward to see the results of it.
Sure, sir. Sure, sir.
Yeah, I found you are the head of it. You are medical officer.
Yes, sir.
Anil Mahida, you are asking for how repertory is just single symptom or very few symptoms in one-sided diseases, and does doesn't get any other information, how to solve this case. So whatever information you have, based on that, you have to prescribe. That is the first thing that you need to do. Like, you may not get every thing in one-sided disease. That is why it is called one-sided disease, right? You add those things, and when you add, what happens is that two things happen. What is missing is the symptom of the disease, which is called as accessory symptom of the disease. Those symptoms that has been present for a long period of time is in fact forgotten by the patient himself, and he understands it to be a part of his life, and he doesn't mention it. So that intensity of that complaint that increases. That's one thing that happens. The other thing that could happen is like whatever is being submerged, the symptom or the drug that you have prescribed to bring in some of the symptoms, which is the accessory symptoms of the medicine. So when the new symptoms come along with the previous symptoms or half symptoms, you get a new picture, and you again prescribe the totality, and again you get a new picture, and again you prescribe. Then you actually get to the original state of it. Like different stages of life has suppressed different things. So the original state would come back with such an approach. You start with a prescription, which is most logical, which seems to be most indicated, and then you get newer symptoms and work on the totality again and again. That's how it is. If you are asking about vision-related troubles, Anil, which you have been working on, you have been asking for time and again, the information related to eye is very less. So that's why you might be finding it difficult. But what is that? It's like you have to go back to your family history. You have to go for the past history, really relevant history, and what sort of assaults would have happened which led to such visual disturbances in people who are suffering visual disturbances. So you can concentrate on it and focus on it. Sometimes it is radiation, sometimes it is medication, sometimes it is damage to the brain. Sometimes it might be because of the vaccination or something. You might have, like not you, but your patients might have had this hereditary influences or a locality should have it. So you can go about it. That's it. Can we have series of such complete dynamics? Yes, sure. Maybe I do once in a month because I'm a little lazy, laid back, and also have lots of work to do. So probably I'll have to take time and do. But yeah, of course, if people, yeah, I wanted to say this: if at least 30 people are ready to listen, I will obviously make it once in a month or 15 days. You can write to me on Facebook. I think you're all, most of you are on Facebook. You know my profile. Or else you can write on drajeshr@icloud.com. If at least there are 30 participants, I would definitely do it. And the other thing is, actually, I have signed up for with a reputed institution which wants to have a basic course on repertorization, which is structured, which is in a series of lectures, not like continuous 2 hour or 1 hour one, but it is in the form of module wherein you can have 5 to 6 videos for a beginner and 5 to 6 for an intermediate practitioner, or in fact 10 videos for an intermediate practitioner, and then a little more for the advanced practitioners. The difficulty today was like why it went in a different way is because I was addressing beginners who are students. I was addressing who are just into practice, who are intermediate. I was also addressing somewhere like people who are already 15 years, 20 years into practice, who are not into repertorization. So to make an ensemble of all these things and put together was a little difficult, but I think I did reasonably well. So that's the thing. Any other questions? If you people have, you can ask, or we will make it. I am very sorry for making all of you wait, and also to you, Abhishek, Dr. Abhishek.
No, sir, no.
I didn't think that it was this long, but I thank really. I'm really thankful to those people who are listening to it, so patient, all this 55 to 60.
So I think there is no more questions.
Yeah.
So at the end,
so we'll take a leave.
Yes. So at the end of session, on behalf of Government Homeopathic Medical College Bhopal, I would like to thank you, sir. It's been an honor to be among such lucky individual to know the unique features of repertorization through your live case presentation, and also to know that we can quickly reach how to quickly reach to the similimum. There were lots of take-home messages from you, sir. I think all other participants are also feeling the same. Thank you again, sir, for your time. Also, I would like to thank all the participants for being here today. It's been very happy, wonderful session, sir. Now it's finally time to end today's webinar. Thank you all. Thank you, sir.
Yeah, thank you. I thank you, everyone, and I thank you very much for the opportunity. My thanks to Dr. Mishra for giving me this opportunity.
Yes, yes.
And thank you very much for watching it patiently. Because some people would say, sir, we are short of time, please finish it off. But you were kind enough to let me to continue for so long. And thank you for everyone who has participated. And thanks for the kindness to patiently listen to what I have said. And thank you once again. Happy Onam. Good night.
Thank you, sir. Goodbye. Good night, sir. Good night to all.
Enquiry for dealership and commission on sales, please send email to repertory@nambisons.com.